Mastery of the surgeon's one-handed knot is essential to performing arthroscopic procedures that require suture fixation. In order to maximize efficiency and minimize awkward and clumsy fumbling with instruments, the arthroscopic surgeon should be comfortable tying one-handed knots with the hand he does not use for the instrument manipulation. There are two components of the one-handed knot: the underhand throw and the overhand throw. Beginning with the suture strands crossed facilitates laying the first throw flat. Here we demonstrate the underhand throw, and the overhand throw. We advocate making 5 throws when tying one-handed knots. We begin with 2 throws in the same direction. This produces 2 half hitches, which can slide about the post strand. In this example, we begin with 2 underhand throws. Here we see the first throw laid flat. Allow it to float down. The third throw is made in the reverse direction. Here, overhand. To float down. The fourth and fifth throw, then alternate direction. Here we simulate tying with a simulated knot pusher. Note that the instrument is placed on the lower or tuberosity suture strand, and we begin with the suture strands crossed. The first throw is made in underhand fashion. We pause here to make a very important point. When tying one-handed knots, by definition, the suture strand being used to tie is not the post strand. Watch closely as we demonstrate flipping the throw, which effectively switches the post strand. This is achieved by applying differential tension to the individual suture strands. The overlaid arrows indicate the direction of pull on the suture strands. This demonstrates how the instrument gently floats the free suture strand down over the post strand with no tension whatsoever on the free strand. Note that the instrument pass points to lay the throw flat. The second throw is made underhand, then flipped to allow it to float down. At this point, the 2 throws have assumed the configuration of the blue half hitches about the white post strand. It is essential that the tension is maintained on the post or white strand while no tension is applied to the strand passing through the instrument. By pulling on the post strand, the knot is drawn down tightly. Only after the knot has been fully drawn down is the instrument used to pass point and tighten the half hitches. The third throw is made overhand, flipped, and floated down to the cinched knot. Before the throw is seated, however, tension is relaxed on the post or white strand, the instrument is used to pass point, and tension is then applied to the strand passing through the instrument. At the precise moment that the throw begins to flip, equal tension is applied to both suture strands. With the line of pull at 180 degrees, the throw lays flat, a prerequisite for laying the subsequent throws down as square knots. The remaining throws are made in alternating directions and are laid down flat. The ideal construct for surgical knots, whether performed open or under arthroscopic visualization, is a series of alternating half-hitch throws laid flat into square knots. This image demonstrates the optical surgical knot. Note the appearance similar to a chain of identical links. Each pair of central strands is parallel, having been laid down flat. While alternating under and overhand throws creates the foundation for tying square knots, the subtlety of differential strand tension determines whether the throws lay flat and square or appear as half-hitches thrown about posts. Both of these knots were made using identical throws. The knot on the right, however, appears as a series of half-hitches about alternating posts. Although the direction and the posts were reversed with each throw, the throws were not laid flat. Half-hitches about posts are looser than flat throws and are more likely to fail by untying. This next example on the right represents probably the most common configuration seen in arthroscopic knot tying, a series of alternating half-hitches about a single post. While the throws were reversed each time, they were not laid flat. This construct does provide some fixation due to the friction induced by the half-hitches. The danger, however, is the post ultimately can slide within the stack of half-hitches, especially when subjected to cyclic loading. The final example is a series of granny knots. This configuration occurs when the half-hitches are not thrown in opposite or alternate directions. In the surgical setting, granny knots are inferior to square knots because the granny knots are more prone to slippage and coming untied. We now move to arthroscopic knot tying in the context of rotator cuff repair. In this demonstration, we use a shoulder model where a suture anchor has been inserted and one strand of suture has been passed through the rotator cuff tendon. Both suture strands have been extracted through the lateral, working cannula. The bursal suture strand is identified. A loop suture grasper encircles the strand at its bursal exit point and is withdrawn from the cannula, clearing any twists or tangles between the suture strands. We place the bursal strand in a cephalette position for identification purposes. The arthroscopic knot tying instrument is placed on the tuberosity suture strand and a hemostat is applied at a distance from the cannula comfortable for the surgeon. The hemostat serves a dual purpose. It provides a convenient lever for applying tension to the suture strand, and it protects against dropping the tying instrument, which could result in surgical delay for re-sterilization. As demonstrated previously, the bursal suture strand is crossed under the tuberosity strand prior to initiating the underhand throw. We make the underhand throw and flip the suture using differential suture strand tension, effectively switching the post of the half-hitch. This maneuver is performed external to the working cannula and allows us to float the throw down to the repair site under no tension. Rather than forcing the knot down a post in knot pusher fashion, gently pulling the throw down as demonstrated protects the suture material and helps prevent premature locking of subsequent throws. Tension is not applied with the instrument until the first throw lays flat. Again, the second throw is made underhand, then flipped to allow it to float down. At this point, the two throws are in half-hitch configuration. It is essential to maintain tension on the post strand, while no tension is applied to the strand passing through the instrument. By pulling on the post strand, the knot is drawn down tight. Only after the knot has been fully drawn down is the instrument used to pass point and tighten the half-hitches. The third throw is made overhand, flipped, and floated down to the cinched knot. Before the throw is seated, however, tension is relaxed on the post strand, the instrument is used to pass point, and tension is applied to the strand passing through the instrument. At the precise moment the throw begins to flip, equal tension is applied to both suture strands. With a line of pull at nearly 180 degrees, the throw lays flat. The remaining throws are made in alternating directions and are laid down flat.